morning. Thank you to our local media and our provincial media for joining us this morning. We are here to talk to you today about EMS dispatch. This morning we have joining us Mayor Beer, Mayor Spearman, Mayor Scott, and Mayor Nenshi. We will start this media conference with each of the mayors, and at the end we will shift into a Q&A session where we will address some questions from our media. We just ask that you virtually raise your hand in the Zoom meeting queue, and we will call on each of you respectively to pose your questions and put them to the mayor that you request. This morning, I will kick things off by asking Mayor Tara Beer to join us first.
Good morning, my fellow Red Deerians, Albertans, and members of the media who've joined us today from across the province. I'm pleased to be joined today by my colleagues, Mayor Spearman of Lethbridge, Mayor Nenshi, the City of Calgary, and Mayor Scott, the Regional Municipality of Wood Buffalo, as we continue to stand in solidarity with one another against the Minister of Health's decision to consolidate ambulance dispatch in our province. As many of you will know, we have been strongly advocating to the provincial government and engaging with Albertans on this issue because it truly is a matter of life and death for every Albertan, and not just for the communities that we represent and stand before today, but certainly for all 4.4 million of us. As mayors, we continue to stand together resolute in our position that this decision compromises the health and safety of all Albertans. The consolidation of ambulance dispatch in our province means 3 potential emergency response changes for all Albertans, unfortunately beginning tomorrow morning when AHS will start to deintegrate our long-standing integrated system. The end of, number 1, the end of integrated emergency response, a partnership between fire and ambulance that Alberta was once a leader in our federation in. Number 2, a degradation of emergency response. Dispatch calls will take longer, and fire medics will no longer be quickly dispatched to attend emergency scenes when ambulances are unavailable, if the fire medics are dispatched at all. Number 3, Albertans will be left to wonder what the future of this emergency services changes signals and what other changes may be on the heels of the imminent cuts to the 911 ambulance dispatch as we know it. Beginning tomorrow, Alberta moves from 7 emergency EMS ambulance dispatch centers to only 3 for a province of 4.4 million people. For our communities, this issue is not about partisanship, it is not about politics, or as some have speculated, it's not even about the money. It is not even about preserving the status quo, for we are willing to work with the province to make much needed improvements to the entire pre-hospital healthcare system. But this issue is about life and death. In fact, we believe in integrated emergency response so strongly that Lethbridge, Red Deer, and the Regional Municipality of Wood Buffalo are willing to pay from municipal funds to safeguard local integrated emergency dispatch. We flagged our willing and our offer to pay for the Minister of Health in November. We made a formal offer to the Premier by way of letter, and our letters of offer on our request to meet with the Premier, have a call with the Premier, have yet to be formally responded to. Losing integrated dispatch means ultimately losing integrated emergency service response. Let it be known that there are Albertans who are alive today because fire medics responded because an ambulance was too far away to respond. In many cases, and our crews on the ground can stipulate to this, in many cases, ambulances are tied up in emergency wait rooms at the hospital. They're tied up in other communities and they're 15 to 20 minutes away. So our fire medics respond in about 4 to 6 minutes. It absolutely does not make sense for fire medics to be at the fire station when they can be on an emergency call. Losing dispatch means that fire medics will no longer in our communities and regions be immediately dispatched in critical emergencies. This unnecessary emergency healthcare cut will impact patient care. Under the consolidated AHS model, fire would not be dispatched immediately, if at all. And without the coordination that we have had for many, many years, there will be a delay in care for patients. In Red Deer alone, when the fire unit was dispatched, they arrived first on scene 40% of the time. If the province follows through on their plans to cut Alberta from 7 centers to 3 beginning tomorrow, local medical 911 calls will now only be responded to by ambulances, which, as I've noted, are often tied up in other communities or at local hospitals. The advanced life support trained fire medics, which are only 4 to 6 minutes away, will not immediately be able to send the fire truck to provide emergency care. My colleague mayors and I want to unequivocally go on public record and say that this is wrong and this is a waste of public resources. And it takes our province back 30 years in terms of emergency response times and patient care. 4 previous ministers of health have overturned the intent of AHS in implementing this reckless plan. The current health minister has indicated he will not be overturning as his predecessors, who served under 4 different provincial governments. So we appeal to the Premier. We have not yet heard from the Premier. We appeal to Cabinet, many of whom went on public record against consolidation when they were the official opposition in 2016. To date, we have been told that this seismic shift in the emergency services landscape in our province is supposedly about patient outcomes. However, based on actual scenarios of AHS ambulance delays and mapping error that our fire medic crews frequently encounter, this change cannot defensibly be stated to be about patient outcomes. As we have stated repeatedly, in critical situations, seconds count, and they can be the difference between life and death. But the province has not heard us on this issue, and they are no longer responding to us on this issue. They are not putting patients and people first, which is why we have continued to appeal for the active support of our citizens in this fight for retaining ambulance dispatch locally. We want to go on, as noted on public record today, this mistake is entirely preventable. The experience of other Canadian provinces who consolidated dispatch proves that this change will fundamentally dismantle a public service that we once led the way in Canada on. Our communities implore our province to please pause and to stop this mistake, which is entirely preventable. Past centralizations in other provinces across the country have, past consolidations in the province have resulted in a degradation of service in those respective communities. There are mayors 39 mayors who've gone on public record indicating that they realized a degradation of service in their communities. And as this is the final consolidation in the province of Alberta, we have yet to fully realize the intended and unintended consequences of this plan. Other Canadian provinces who have consolidated their dispatch now have external reports making recommendations to return back to a local regional model of dispatch because of the consequences that it has had for patient outcomes. Premier, there is still time to do the right thing, and we want to let it be known that Albertans will rue the day that this change happened in our province, and mark our words, there will come a day where if the switch is flipped tomorrow, then unfortunately in a few years' time, we will be in the very unfortunate position of having to call for external reports, which will no doubt, like provinces in BC and Ontario, call for a return to local and regional dispatch. I will now turn the floor over to Mayor Spearman of Lethbridge.
Thank you, Mayor Veer, and good morning, everyone. The provincial Ernst & Young report identified a possible $5.7 million in savings by closing satellite dispatch centers and consolidating and centralizing EMS dispatch. The city of Lethbridge, like other cities, has offered to pay our share of that cost, $1.2 million, in order to retain EMS dispatch in our city and region. Paying $1.2 million will prevent our city from having to spend $5 million in additional costs related to mitigating risk and to ensure we maintain the same service level to our community after EMS dispatch is removed. These costs will be put on our city and on our taxpayers as we lose efficiencies currently realized within our fully integrated system. We strongly believe that our existing system works well and provides the best patient outcomes. We have only 6 ambulances in the city of Lethbridge, and it's not unusual to have several of these ambulances committed to interfacility transfers. Our integrated fire EMS systems mean that our firefighters are also paramedics, and our fire trucks are equipped with advanced life support equipment. In situations where all existing ambulances are in use, our Lethbridge Dispatch Center can send the nearest fire apparatus to a medical emergency to begin life-saving procedures when the nearest available ambulance could be 20 or 30 minutes away. In Lethbridge, we have one dispatch center for EMS, fire, and police. In emergency situations where more than one service is required, the information can be quickly and easily shared, providing the fastest possible response by all services to address the situation. Siloing EMS dispatch and separating it from the other emergency services will result in fragmentation of services and poor patient outcomes. Minister Shandro has consistently failed to address this issue and has not demonstrated that he understands it. The decision to proceed with EMS dispatch consolidation is a reckless one that will jeopardize patient outcomes. Our municipalities have spent more than 4 months trying to work with our provincial government on this issue. There has been no indication from Minister Shandro or this provincial government that they wish to work with municipalities. And our appeal to Premier Kenney appears to have fallen on deaf ears. In summary, if EMS dispatch consolidation proceeds tomorrow, it will be evidence that this health minister and this government care little about patient outcomes and wish to impose a system with a lower level of service and no accountability. This is an unforced error. The government could correct this in the interests of all Albertans. It's time to act, Mr. Kenney. You either have to support your health minister or support Albertans. Today is decision day. Thank you.
Well, thanks very much, Mayor Spearman. Deja vu all over again. I have been managing to fight against this issue for over 10 years now with multiple health ministers in multiple governments of different stripes. It has been the wrong thing to do for a long time, and it continues to be the wrong thing to do. You know, I always remind myself that although this is not about my personal experiences, that my dad was one of those people who survived because the firefighters got there first. And he was able then to see his second granddaughter be born. He was able to see his son sworn in as mayor. This stuff matters. It's not a hypothetical question. It's a question about people's actual safety. And time again, Alberta Health Services has shown that they are more concerned with the bureaucratic desire for control over this element of the system than in preserving a system that works and keeps people safe. And for me, that is unconscionable. So while all of our calls to bring data to the table, to bring evidence to the table, to talk about the best system that we're trying to build together have fallen on deaf ears, our concerns around the transition have only grown. So as you know, we are hours away from the beginning of this transition tomorrow, days away in Wood Buffalo, Fort McMurray, and in Calgary, where the transition is expected to start on January 26th. And everything we were worried about this opposition, of AHS not being ready, of the transition being bungled, are sadly coming true. Despite our opposition to this, our staff have tried since August diligently to work with AHS to make the transition as smooth as possible and to fix the glaring problems in the system. They have received very little to no response. We have asked multiple times for data on how the system currently works, on how it has impacted nearby communities that have gone through consolidation. And despite continual promises to send us the data, we've received nothing useful. What we have received, in fact, has shown that service massively degraded in the areas around Calgary by many multiples in terms of increasing response time, but we haven't heard anything beyond that. And what I'm very worried about right now is the issue of real transition. The danger in this has always been that AHS having emergency medical services in its own silo would mean that we wouldn't be able to work with the other life-saving agencies, particularly, as the mayors have stated, in fire, but also in police. In Calgary 911, all of those services are in the same room. And we've long held the world-class practice of simultaneously collecting critical information from the same caller from multiple agencies and transferring the caller to police as needed. These practices are important because they shorten response times, but they also protect the safety of the first responders to ensure that they know what they're getting into. And I want to talk a little bit specifically about police. In the last week or two, AHS has informed us that they will not be implementing best practices in terms of dealing with police. We've been informed that there is no plan, nor is there a plan to have a plan, for what we call co-evaluation, which means that the police, the fire, and the EMS dispatchers, in this case, there would be 3, in the current system there are only 2, simultaneously collect the information from the caller. We've also been informed that AHS will not transfer callers to the Calgary Police Service if police is required. Instead, they will inform Calgary 911 if they deem it appropriate. No protocols, no practices. This is not good enough. It is far from good enough. And this is something that we have to be very careful of. This week, one of the more difficult conversations I had is I spoke with the 911 operator who managed the call in the horrible events on December 31st on New Year's Eve. She did an amazing job. But she had to coordinate 3 different agencies, all focused on a life-saving goal. And we will lose that. And that is deeply problematic for me. When the chief medical officer or the chief paramedic and other officers of AHS presented to Calgary City Council on November the 22nd, they committed that the transition would not negatively impact the service provided to Calgarians. However, they have taken no action to actually assure that that is true. And this is terrifying. It is actually very, very scary that this bureaucracy has not actually thought through the operational elements because they're so excited about their victory in gaining control over this piece of the health system. This is a very, very bad outcome in the middle of a pandemic, in the middle of a moment where in the UK, we see that the ambulance system is so overburdened that they have to require other drivers to do ambulance work. Why in the world would we make this change that we know is going to degrade service at this critical moment in public health? So if the Premier and the Minister are not willing to cancel this reckless decision, at the very least, let's pause it until the pandemic is over. Let's give solid direction to AHS that they've got to get their ducks in a row before they go ahead and do this, and make sure they've solved questions around data sharing, around transition of calls, around integration, and around co-evaluation. And let's move forward in a way that protects the health of Albertans. Right now, the plan does not do that. I'll turn it over to Mayor Scott of the Regional Municipality of Wood Buffalo.
Thank you very much, Mayor Nenshi. In just 8 days, Alberta Health Services will take control of ambulance dispatch in our region. This is a decision that they imposed on us August 4th, and we have been fighting against this plan ever since. During these last few months, we have tried endlessly to voice our concerns with this government. We've shared facts and evidence-based rationale as to why we need to keep our dispatch local. Residents of my region have written more than 2,500 letters to the Minister of Health on this very matter, which have gone unanswered. This government continues to ignore our voice on this issue. The UCP government is pushing through a reckless plan that will cost lives and degrade our level of patient care. This decision directly threatens the health and safety of Wood Buffalo residents. Our region is larger than the province of Nova Scotia, and the next closest ambulance is 3.5 hours away. We have offered to pay for the service so that we can keep dispatching our own ambulances, and this will be at no cost to the province. Premier Kenney has been silent on this matter, and our residents are demanding answers. AHS has told us that they will remove our ability to dispatch our own ambulances on January 19th, but we do not have confidence in AHS. We are demanding information from AHS and have not received answers to many important questions. Premier Kenney, we need to know what will happen when a major vehicle collision north of Fort McMurray happens this winter. Will our mutual aid EMS partners at the closest oil sands site respond to the emergency like in our current model? Or will the next closest ambulance need to come from Timberley, which is 50 minutes away? How will ambulances be dispatched to our remote First Nation communities, such as Fort McKay? Currently, ambulances arrive quickly after we dispatch them from oil sands mutual aid partners at our nearby oil sands sites. Under the new model, will residents in Fort McKay need to wait until the next closest ambulance arrives from Lethbridge, which is 3 hours away? January 19th is fast approaching, and we don't have answers to these important questions. It is simply unacceptable to ignore the voice of our region and countless other Albertans. We are calling on Premier Kenney to stop AHS' reckless plan to remove our region's ability to dispatch ambulances and actually listen to Albertans. At the very least, push pause on this decision, delay this decision until we are provided answers to these very important questions. Lives will be at stake, and surely some will be lost if Alberta Health Services proceeds with the transition on January 19th. This approach was overturned 4 previous times by 4 previous health ministers for a good reason. 90% of the time, we dispatch faster than AHS. This will cost both time and lives. The provincial government needs to do better. Thank you very much.
So we'll open it up for media questions, but just in summation, commencing tomorrow, January 12th, until the end with the phased flipping of the switch in the communities represented here today, but also the regions that we serve. AHS will flip the switch, ending 30 years of integrated dispatch services for the province of Alberta. And notably, the city of Red Deer for nearly 60 years has dispatched ambulance. So 30 years of integrated service that was once lauded in our federation. Tomorrow begins the process of pre-hospital care emergency dispatch cuts from moving from 7 centers in the province of Alberta to only 3 in the midst of a pandemic. We still appeal to the Premier today to do the right thing. We appeal to Cabinet to intervene and to do the right thing. And if you still are intent on moving ahead with a consolidation and this ill-advised plan, we've heard about the transition issues that the city of Calgary so far has been fraught with. And we ask the Premier and Cabinet that you would pause implementation until protocols in the interests of public health and safety can be put in place to mitigate the transition, of which we, again, want to go on public record and say that we unequivocally know that this is wrong for the people of Alberta. We'll now take your media questions.
as we shift into media questions, we just ask that each of the media virtually raise their hand utilizing the tool in the Zoom webinar. We will address each of you in order and we will take as many as we can. We will go to Madeline Smith first. Madeline, can you share your question with us, please?
Hi, can you hear me?
We can hear you, Madeline.
Perfect. Yeah, my question is for Mayor Nenshi. Mayor, can you explain a little bit more about what you were speaking about with CPS notification of calls? This isn't something that I've heard brought up before with this issue. So what exactly has the province told you about how they will be approaching notifying police if they're needed on calls that EMS is responding to? What would you like to see done to mitigate that, short of pausing this whole transition altogether?
Sure, thanks, Madeline. Hopefully I'm back to right side up. I understand I was upside down for a while there. The blood was rushing to my head. That's why I was getting so emotional. But so right now, the gold standard in how to do this is you do something called co-evaluation. That means that you've got the police dispatcher and in the current system, EMS fire dispatcher on the line at the same time with the caller, so that each is getting the information they need to do the dispatch correctly, because obviously they ask different questions. You know, the AHS or the EMS dispatcher is focused on the health issues, but the police dispatcher knows what security questions need to be asked as well. So that's the gold standard, and that's what we do in Calgary 911. The second standard, kind of the silver standard, is you transfer the caller. So you actually send the caller over to the police so that they don't have to repeat their story, but they can answer the police required questions. The idea here is, let's say that there's a domestic violence situation that has resulted in an injury, but without the police knowing some of the background, they don't know who the perpetrator is and who the victim is, for example. And that can lead to a very dangerous situation for the callers, but also for the police officers. And so the silver standard is that you transfer the caller and they talk to the police dispatcher. What AHS has said is that they will not be ready with anything by the time of the transition. And they have no plan or timeline for when they would introduce either of these elements, which is a co-evaluation or call transfer. Instead, once the caller is hung up, at their own discretion, with no guidelines on when or how to do it, they may or may not inform Calgary 911. And they haven't said how they would inform Calgary 911. I know this sounds ridiculous, because I can't even imagine why you wouldn't have standard protocols in a place like 911 where you require standard protocols to figure out how to do this. But we were informed of that just last week. And so it's very clear that AHS is simply not ready. That in the 6 months that they've been talking about this and fighting about it and saying misstatements about it, they haven't actually spent the time getting ready for it. And that's a very big problem.
Thank you, Mayor Nenshi. We have a question from Red Deer Advocates Lana Michelin. She is asking for Mayor Veer, is there anything further that the municipalities can do to show their disfavor with the change at this point?
Thanks for the question, Lana. So I will say we started on this issue in 2009 with the governance transition of ambulance. And obviously the whole dispatch issue has come up over the past decade, as Mayor Nenshi has noted. The province is implementing an 11-year-old plan, and it was an 11-year-old plan that municipalities across the province disputed when they first tabled it many, many years ago. The commitment of AHS at the time of the governance transition, so again, this wasn't dispatch, this was the governance transition, was that there would be no degradation of service. Well, immediately after the governance transition, Red Deer went from 9 advanced life support ambulances to sort of a hybrid model. AHS only funded 5 ambulances in our city and region. And then they were a hybrid between advanced life support and basic life support. And so we made a choice in the interest of public health and safety, and we've continued on that commitment to subsidize the healthcare system with the medical first response through the paramedics, and advanced life support there. So our point has been made in principle for over a decade. I will say over the last year, if you look at the timeline, the Ernst & Young report was tabled in February, indicating that the province intended some cost savings with dispatch consolidation. When the Minister of Health was in Red Deer announcing the hospital expansion, I flagged for his staff that we needed to meet on that sooner rather than later because we had deep concerns about a one-line report that would have such a seismic impact on emergency response throughout our province. At that time, they had said that no decisions had been made and that we still had time to engage with the province on it. Of course, the pandemic hit, so those discussions were deferred, and they were continually deferred until notice was given to us in August. Since August, with my colleague mayors and myself, we have met with the Minister of Health. We've had multiple conversations with the Minister of Health. We have engaged our local MLAs, each of us in our respective communities. We've engaged with MLAs across the province, whether they were directly or indirectly affected by this issue. We have written letters disputing the change to every member of cabinet. We've had many conversations with members of cabinet and with MLAs and members of the UCP caucus as well, disputing the change. We've particularly met with members who went on or spoken with members when they were the official opposition who went on public record saying that they disputed this change. And we've had many MLAs say that they support our position. And finally, when the Minister of Health indicated that he would not be overturning, then we made it publicly known that we would be appealing to the Premier and to Cabinet. And we issued a formal letter of offer. We didn't hear anything back specifically from Premier and Cabinet about overturning. So Lethbridge, Regional Municipality of Wood Buffalo, and Red Deer, we made the letters of offer, which remain unanswered. And we've had a couple of calls scheduled with the Premier's office, which have also been canceled. So, and most importantly, we've engaged with Albertans on this issue, not just our own local citizens, which will be directly affected immediately, but we've endeavored to engage with 4.4 million Albertans because ultimately this is a cut in pre-hospital emergency care in our province, going from 7 centers to 3 in the midst of a pandemic. So we've engaged with Albertans. Our citizens have written letters and emails and engaged with MLAs. As Mayor Scott noted, his citizens, they've submitted 2,500 letters. Same in Lethbridge, Calgary. You know, there's been very active social media presence. So, you know, I think we have done absolutely, we've engaged every advocacy, legislative, and media tool that we possibly can. But unfortunately, the government, and at this stage of the game, the Premier's office is no longer engaging with us on it. Unfortunately, they're not answering us with respect to that. We do have a call tentatively scheduled with a member of his staff tomorrow, but tomorrow is when the switch is being flipped. And then we do know that there are many MLAs in cabinet, as well as MLAs in the UCP caucus, who do agree with our position. But unfortunately, that is not the position that the Minister of Health that has been taken. So we do know that there is division on this issue and that there's a lot of support and solidarity, that local regional dispatch is critical and is important and is in the health and safety interests of Albertans. So, you know, really, I think we've exercised absolutely every tool. If they proceed and flip the switch tomorrow, then we will begin aggressively discussing, as Mayor Nenshi has noted, we'll again be, our operations teams have been discussing a transition because we had to exercise that due diligence. So at an operational level, they have been discussing transition with HS, but certainly we will aggressively be pursuing transition challenges and trying to mitigate those transition challenges if indeed they do decide to end integration in the province of Alberta tomorrow morning.
Thank you, Mayor Veer. We will now go to Taz Dhaliwal with Global News. Taz, do you have a question for us?
Yep, I do. I have a question for Mayor Chris Spearman. He said that concerns are falling on deaf ears. And in a previous interview, he said that the former Minister of Municipal Affairs just wanted to show who's boss of the municipalities. I'm just wondering if there are any hopes for better communication now that we do have a new Minister of Municipal Affairs.
My answer would be yes. Minister Rick McIver, who's the acting minister, has there been a change since? He was a former municipal councillor in Calgary, of course, and would have better insight. I think he was the only cabinet minister in the UCP government that actually had previous cabinet experience. So yeah, I'm very concerned about the reaction of this government and their willingness to work with municipalities, but I'm hopeful that Minister McIver will be an advocate for us. He was opposed to ambulance dispatch consolidation previously, and I hope that his views have not changed and that he will advocate for us within the government. I'm very concerned that this health minister is not listening to Albertans on a series of important issues related to health. And in this case, when seconds matter, when lives are at stake, we have a minister who's ignoring the best practice and choosing to impose a system that their bureaucrats have long desired, which is not in the interests of Albertans. So my appeal is to Premier Kenny, overrule your health minister or change the health minister. He's not listening to Albertans.
City of Red Deer, I can supplement and concur with Mayor Spearman. On behalf of our Dispatch Mayor Caucus, immediately upon the interim appointment of Minister McIver as interim Minister of Municipal Affairs, our office did reach out. As Mayor Spearman noted, we were hopeful because when he was a Calgary councillor and with his knowledge of the importance of the integrated system, that Minister McIver would in principle support. We knew that on principle that he understands and respects how critical integrated dispatch and integrated response is. When we did reach out formally to the new interim Minister of Municipal Affairs to his office, they indicated that it was a health matter and that they would be routing us to the Minister of Health.
Thank you, Mayor Veer. We will now go to Adam Toy with Global News. Adam, do you have a question? Adam, your microphone is on mute.
I'm sorry about that. Clarifying question for Mayor Nenshi about police. You're saying that once the caller hangs up and the matter is the matter then left to the AHS operator to decide to forward or to contact CPS, or would it be up to your understanding, would it be up to the caller, the person who initially called 911, for them to call to seek police help?
My understanding is that it would be up to the AHS dispatcher to contact Calgary 911 at their discretion, and that there are no criteria or protocols in place for when and how they would do that. So imagine if you're the caller, you called 911, the ambulance is on their way, the situation is escalating, you need police, now you're gonna have to call and start all over again. This is ridiculous.
Thank you, Mayor Nenshi. We will now go to the Calgary Herald. Tim, do you have a question for us?
Well, this is the Lethbridge Herald. Is that who you're asking about?
Yes,
Tim.
Lethbridge Herald. Thank you. My apologies.
Yeah, I don't have a Tim.
Yeah, I just my question is for Mayor Spearman, but also the other mayors may wish to answer it. Mayor Spearman has talked about before the fact that a lot of the ambulances that we have in our city are tied up on interfacility transfers and not serving the people in Lethbridge, and so leaving the fire trucks essentially over the last number of years to kind of fill in the gap. Now, has the province addressed this issue with you, Mayor, or any of the other mayors? And maybe this would be a way to get past some of these problems that we're having.
They simply accept that service, and actually they pay nothing for it. This service is totally funded by municipal taxpayers when fire apparatus responds to medical emergencies. We have been supplementing. The various provincial governments have not taken any action to provide an alternative service to provide interfacility transfers. So I think it's shocking that cities the size of Lethbridge and Calgary have only 6 or 7 ambulances. In Lethbridge, it's 6. It's not unusual to have 3 of those ambulances out of the city on interfacility transfers. So leaving only 3 ambulances. In an instance where an emergency call comes in and those 3 ambulances are tied up, under the AHS system, we're counting on them to call back and request a fire apparatus. And we're not confident that they'll consistently do that. And the nearest ambulance might be 20 to 30 minutes away. I think that's shocking service. It's a blatant disregard for people who are suffering health emergencies where lives are critical. So it's very important that we move forward, that this government begin communicating and letting us know how these systems will be handled in the future. Right now, it's been a wall of silence, and they're just determined to move forward with this change. I think it's completely unacceptable for a government that needs to be accountable to Albertans, where people are asking for credibility from this government. There's been no credibility in their dealings with municipalities. Thank you.
Yeah, I would just supplement this comment by saying that in my region, it's going to be a catastrophic decision. So when we have a code red situation, we have 5 ambulances here. So when there's a 5th medical call that comes in, and that happens about twice a week currently, our ability to dispatch another ambulance would come from 3.5 hours away, which is Lethbridge. Normally, we would rely on our fire people who are trained in this, but under the new AHS system, that's not going to be possible. So this is in my view, a catastrophe in this region.
This is Mayor Vera. I'll weigh in on that as well. In our region, so our health region is about 400,000 population that our health region serves. We have five ambulances rather in the city of Red Deer, and like Mayor Spearman had said, they are often tied up in the emergency room at the hospital because there's no beds at the hospital, or they're on interfacility transfers, or they're responding to a call in another city in our region. 40% of the time, our advanced life support fire medics arrive at the scene before the ambulance, just because there's not the ambulance availability. Dispatches, there's sort of 2 key issues. Dispatch is absolutely essential to us to be able to supplement the health system, to be able to send the medical first response through the fire medics. If we cannot dispatch, we're not on the call, so our crews on the ground will not know that there is an incident or that the ambulances, there's a shortage of ambulances, so we won't be able to sort of step in the gap there. But the second issue is there is not clear protocols for when AHS will bounce a call back to fire with what their standard is of the ambulances, of when they would queue to call in the fire medics, because there's a shortage of ambulances. So there's 2 key issues. Not having dispatch completely takes us out at the knees in our ability to subsidize, like we have for many, many years, with the medical first response through the fire medics. But secondarily, HS has no protocols. Mayor Nenshi highlighted no protocols for when they bounce back to police, but they certainly have no protocols for when they will. In fact, they don't really recognize the medical first response on the fire medics as being essential to the healthcare system. And so without those protocols, we have absolutely no ability. Our hands are completely tied. So we could, in theory, and we've had scenarios like this before, where an ambulance is 20 to 25 minutes away in a surrounding community. We could have an advanced life support fire engine sitting at the station 4 or 5 minutes away from an accident scene or from a domestic call where they could attend, but they will not be able to attend under this new model because they wouldn't know about the call.
Thank you. We will now go to Sheldon Spackman with RD News Now in Red Deer. Sheldon, can you share your question with us, please?
Sure. This question is for Mayor Veer. Just wondering if the city of Red Deer has received any communication on this issue from its 2 MLAs.
I will say, so no, I wouldn't say we've received formal written communication. Early on, when AHS first gave notice to the city of Red Deer, they did come in for an emergency briefing immediately upon us hearing notice. Both MLA Stefan as well as Minister Lagrange did come in for an emergency briefing with myself and with our chief McMullen, and they did tour the dispatch center so that they could understand the full workings of it. I will say as well, Minister Lagrange has a very strong working knowledge of the integrated system and has advocated for us very much so in Edmonton on it, because she does have strong personal working knowledge of the integrated system. MLA Stefan also attended our briefing of the UCP caucus in Edmonton and had some really good questions, and he had some good questions about the way the integrated system works. So in terms of his advocacy, you'd have to ask that question to him directly. But no, we have not received written communication from either one of them, but they have attended all the briefings that we've asked them to. And I do know that on principle that they have understood and heard our local concerns.
We're going to take one final question for today from Global News Calgary. Global, can you please share your question with us?
Yeah, I just had a question for Mayor Nenshi regarding the discussion around protocol when it comes to dispatching police. I was wondering if any communication has taken place between the city of Edmonton, who has already undergone this change, about how that looks like in their city.
I have not had a conversation with them about it. What I can say is that Calgary's situation is kind of unique because we've created this highly integrated 911 center. So we've been able to offer a much higher level of service than in other places. And that's what I'm worried about. So, you know, it may well be that they never had that kind of integration in Edmonton. And certainly I know for the other three mayors here, there is a different situation. Two of them deal with the RCMP. So there is a different situation in terms of that communication. So what's really the problem here is we've created something better in Calgary for a very low cost. And that's what I'm worried is being broken.
Thank you to all of our media who joined today. If we were unable to answer any, critical outstanding questions that you might have, you can certainly email us at communications@reddeer.ca, or you can reach out to your respective media departments within those municipalities in which you live. We will close things off. Thank you, Mayor Spearman, Mayor Scott, Mayor Nenshi, and Mayor Veer for joining us.